why are we doing this and why now? Paul alluded to this a bit, but 6 in 10 or 60% of US residents live with at least one chronic disease, like heart disease and stroke, cancer, or diabetes. These chronic diseases are frequently among the leading causes of death and disability in the US, and they're also a leading driver of healthcare costs due to absenteeism and sick time. Additionally, chronic diseases, a rapidly aging workforce, and other factors like stress, fatigue, and depression can all occur simultaneously, and they all affect an employer's revenue. And indeed, evidence from the pandemic indicated that chronic conditions do indeed increase the risk of severe illness from COVID-19 for adults of any age. And so with most Americans receiving health care coverage through their employers, the business community is well positioned to combat the growing costs of managing and preventing chronic disease in the US workforce. So the CDC Foundation does recognize these investments that employers have made and continue to make in workforce health and well-being. And through the first 2 years of this program, we started asking what can realistically be done at that organizational or employer level? What organizational decisions can be leveraged differently to impact workforce population health? And the next slide, I'll share that we saw that across these findings, once synthesized, that it really resulted in a model of factors that aligned well with the Health Next approach. It was a serendipitous discovery, if you will, but the decade-long peer-reviewed methodology developed by Health Next to create a workforce culture of health is one that centers the employer. It recognizes the myriad contextual differences that each workplace has. No one is like another. And this methodology is proven to improve health and well-being, workplace productivity, and work engagement, satisfaction, and retention, while decreasing or stabilizing medical cost trend, and ultimately improving community health and goodwill.